Let's talk about scar tissue. If you've had a hysterectomy or you're about to get one, it's best to learn some of the most effective healing strategies and recovery strategies after your surgery. My name is Dr. Dawn Andalon. I'm a pelvic floor specialist physical therapist, and I work with so many women who are recovering from surgery or they're dealing with pelvic floor issues, core issues, anything to do with this midsection of your body. And having a hysterectomy comes with a lot of questions. But today we're going to talk all about scar tissue healing. What are the best things that you can do to help scar tissue recovery and make that area just heal better, get the muscles to function better underneath, and just set you on a road to success for your recovery. So first things first, I want you to know that whatever your doctor has told you about recovery and healing, please follow that advice. If you're having any major red flags, you might want to go back to one of the other videos I have about red flags, the top red flags after a hysterectomy. That video can talk about some of the things you really need to watch out for. But in this video, I'm going to talk more about the scar tissue healing, things that you can do to help it. And these are things that I teach a lot of my clients how to do on their own as well to speed up the process. So if you have already been cleared by your doctor, you're not having any signs of infection around the incision, and we're talking about more of a total hysterectomy where you have an abdominal incision. This may apply too for those small little portal sites. It's very common to have a laparoscopic surgery as well. So even those small little incisions around your abdominal area, you can use some of these tips to be able to help it as well. Now, why is scar tissue important to address? Well, it can develop. I'm going to use a fake little incision scar here on my hand so you can see my little demo here. But if you have an incision there, especially in a sensitive area in that lower abdominal region, then your muscles and your fascia, which holds your muscle underneath and the fascia lays on top, that area can get restricted if it's healing and you're noticing any pain or discomfort or even trouble later on trying to do core related exercises. It's really important to heal the incision the best way. So we want to try to help any scar tissue that might develop. And how do you know if you have scar tissue there? Well, when you're looking at this incision here, if you take two fingers and you go along that incision, and you're gonna start by just gently going up and down. I'm not putting a lot of pressure there, it's just very gentle. Now this area already might be really sensitive, or you may have like an emotional response or feel like it's really hard to touch that area, especially if it's on your own body. That is totally normal. I see a lot of women that almost have this psychosocial response, this emotional response, because you underwent some trauma there. You had a surgery. And if you have trouble even touching the incision, then you might want to try just taking a piece of Kleenex tissue, and you're just going to get used to that sensation of something touching it. Same thing if you're wearing a lot of loose clothing and you don't like anything against there because it is uncomfortable as it's healing, then you have to start doing what's called desensitizing the scar and the incision. So you're going to rub some very gentle little movements back and forth with a Kleenex or a tissue. So it might look like this. So you're just getting used to it being touched and feeling back in that area too. So that would be the first step. Now, if you have no problem with touching it and you can put your fingers there, and we're talking about at least 2 weeks after surgery, because you don't want to be putting your fingers on there and doing a lot of movement on there when it's still under that healing phase. So give it that 10 to 14 days for recovery. Now, once I move the fingers back and forth along the incision, if you're feeling like any area just doesn't move as well, or you feel like little bumps underneath there, something doesn't feel smooth, and while it's healing, that can be totally normal, but that area can develop some scar tissue underneath, and so you are gonna move it. So how are you gonna move it? Well, like I just mentioned, You'll go along the incision very gently with 2 fingers, up and down motion. So you're just going in a perpendicular fashion against the incision there. Next, you can go either right above or right below, and you can do some small little circles here. So you're gonna go along the incision, and this should take you no more than a minute or 2. You can do this a couple times a day, but you're doing some small little circles. And then later on, you can go on the incision once that's a little more comfortable, maybe it's not as tender, and you can go clockwise and counterclockwise in different directions along there. So this is just some gentle ways that you can start moving that tissue. And this, like I mentioned, is very important when it comes to core recovery, getting your muscles to fire underneath that area, because when you go back to doing more strenuous exercise, if you have a lot of scar tissue there and the skin, the fascia, and the tissue gets really bound down, it's going to be hard for you to activate those muscles underneath. So this is something that I always address with women who have had a hysterectomy, a C-section, anything that has an abdominal incision that's healing. Now, I also have a hysterectomy online step-by-step video program that can really talk you through some of these things more specifically. So check out that link below this video, and also talks you through the best ways to really restore your pelvic floor and your core, how to lift properly, and also how to deal with things like constipation or bladder issues after your surgery. So it's very helpful to learn more of the specifics about your recovery. Now, going back to the scar tissue, once you work on that a couple times a day and you're moving it with circles and you're moving it up and down, you can get to a point later on where you grab onto the incision and you can kind of move it back and forth. So the tissue really needs to be on slack. It's hard to do if you're standing up because you can't really grab that much tissue. So I would lie down with your knees bent or your legs up, and that way you can get a little more pliability in that tissue. And you just do like a gentle pinch, and you're moving it back and forth and pulling it away from the muscle there too, pulling the skin a little bit. We're not tugging too hard, we're just going nice and gentle. Another thing that can be very helpful, and what I do here with the women that I see, is cupping. And you can do some cupping on your own without it being super clinical and going to a practitioner to do it, because it's more of a gentle cupping and soft tissue technique. Now, you can get these cups online. I'll put a link below, but they're basically made out of rubber and they're bendable. There's all different sizes, but if you take the opening there and you pinch it, and then you put it right on the skin, and then you let it go, it's gonna give a suction there. So it's just kind of pulling that skin for you and doing it in a more gentle manner because these are soft and rubber. This might be too aggressive for some people, so definitely wait maybe like 4 to 6 weeks after. Once you have that full recovery and your incision is fully healed and it's not super painful at all, then you can start this too. So it creates a suction, and then you can do the same thing where you're moving it up and down, side to side, even small circles, and moving it along the tissue as well. This is very helpful for your whole abdominal area and gets more blood flow and circulation and just starts to get more pliability of that tissue. So anywhere in your body that you do have a scar or you had an incision from a surgery, it's very important to work on scar tissue mobility. And no one really talks about this, but it can make a huge difference in how that area functions and pulls, because your skin needs to move with your joints and your muscles and everything too. It's very important. So I hope you found these tips helpful, using some cupping, just using the fingertips, and also to work on the right types of core exercises afterward, including some deep breathing exercises, things that are going to start getting the core and the pelvic floor muscles to start to activate, and also learn how to let them go, because you're going to hold a lot of tension there when you are healing. And I hope you found these tips helpful. I have other videos all about hysterectomy recovery, so keep watching those. And let me know in the comments, have you tried this before? Is this totally new to you? I would love to know. So thanks so much for watching. Hit subscribe and you'll be notified when I release new videos. Have a great day.